just want to say hello to everybody who's going to be watching this, and everybody who came tonight. Thank you for being here. This class, by far and away, is probably one of the most important classes that I get to teach each year. And I've been teaching it for probably 5 or 6 years now. It's something that I learned about kind of the hard way a few years back. You know, I deal with a lot of public, I see a lot of patients, and I was catching a lot of colds, something I don't normally do. Usually my immune system is pretty strong from dealing with the public for all these years, and I wouldn't get sick. But then I was having some issues, and it was like every couple of weeks I had another cold. I'd fight it off, I'd be good for a couple of weeks, and then boom, I'd have another cold. So I started doing more and more research, because we know about how good things like echinacea and vitamin C and things like that can be, you know, for when you're fighting a cold, but what could really prevent it? And I started discovering more and more and more research about vitamin D3, which is nicknamed the sunshine vitamin. And the reason it's nicknamed that is because it's one of the few vitamins in the human body that the body can't make and we can't get from food. So the only way we can get it is from the sunshine, sun exposure. Now, sun exposure, most of you probably know, is like a big no-no nowadays. And on top of that, at the same time, we are getting into an environment, and socially, we work in buildings. We're not working outside as much as we used to. We're not getting anywhere near the sun exposure that we used to get, and we're starting to see some really scary things start to happen in our culture, and diseases are on the rise. I'm going to talk about some of the things that D3 is really important for to get into normal ranges, and a lot of the misunderstandings about it, and what's the right levels to have on your blood tests. Ultimately, I recommend for all my patients, get their D3 checked every time they're getting their blood work done, because it's that big of an issue. We have some statements out and some, CDC comments and things like that. We're estimating that almost 85% of our population in the U.S. is below normal levels of D3 because of all these cultural changes that have taken place and our limited exposure to the sun. And what happens when we have less sun exposure? Well, we're not getting the UV rays hitting our skin that do the conversion in our cells to make that D3. And we have to have the sunlight and the UV rays in order to have that happen in our bodies. Sunscreen, what does it block? UV rays. So if we're loading up on sunscreen and going outside, we're protecting ourselves from the potentials of skin cancer, but at the same time, we're limiting our ability to fight something that actually helps protect us from cancer. So obesity is an issue because it's a fat-soluble vitamin, and it can get absorbed into our fat cells and get stored there. That can lower levels a bit. We also know smoking has an effect on our ability to produce vitamin D3 because it limits blood supply to those areas of the skin and slows down that flow of blood, so we're not going to get it from those cells and carry it through our body, because smoking cigarettes cause nicotine, which is a vasoconstrictor, so it cuts out your blood supply to certain extremities and parts of your body. Time of year, obviously the sun's up for much longer in the summertime, much less sun in the fall through the winter, and so we have less exposure to sunlight from that too. So one of the big things is this is one of the big issues we're facing with most diseases is inflammation. And what D3 has been associated with is helping reduce inflammation in the body, and I'm going to talk more about that when we get into some of the research. A couple of points. There's a lot of research out there showing that it boosts your immune system so much that it's almost, well, I won't say almost, it's actually over the last few years, the flu vaccine has been a big miss. Anywhere between 10% and 30% effectiveness. It's not great numbers, but we do everything we can in the world of vaccinations and flu vaccine to try and guess what's going to happen next year. We don't always know what's going to happen. They do their best to try and come out with the best stuff, and some years it just misses. That's just a simple fact. But D3 has been shown to be more effective at preventing people, the general public, than actually getting the flu shot does. It's more effective. So There's more. That's a really important thing to know. And at this time of year, we get into these winter months, we're run down. We've been probably eating some bad foods around the holidays. We're exposed to high temperatures and low temperatures, fluctuations that can put stress on our immune system, stress just in general, worried about, did I get the right gift for somebody I care about, and all the stuff that you're trying to do and get done and accomplish to prepare for stuff, to have a great holiday, and it's just stressful. So we end up with that. There are over 34,000 research papers that have been written, that are out, that are published on the effectiveness of just vitamin D3. Think about that. 34,000 research papers on one thing. That's a lot. That's an incredible amount. We don't hardly ever see but maybe a handful of research papers on things that are really, really important on the things that we do in all of medicine and all of science. But to have 34,000, and that's actually, this is a number from years ago when I first started this. I can't even imagine what it's up to now because it's constantly publishing information about this vitamin. It is critically important. Everybody should be getting their D3 levels checked. Everybody needs to know if they need to be on this or not because it affects so many things in the human body. We used to think it was just for bone density and helping your bones be strong, so we knew it was great with osteoporosis patients, but now we're really finding out how big a vitamin this is. It can help decrease pain and depression. I have had, just in the last few years, girls, teenage girls that have started taking their vitamin D3, measured them, realized they were low. When it comes back, it's completely changing their entire outlook on life. So anything like an issue like that, anxiety and depression, I'm having the parents make sure they get their D3 levels checked in their kids. It's a big deal. Pain, chronic pain, it helps with that, decrease those levels. Diabetes, it helps with. Stroke, decreased chances of heart disease and hypertension because its effect on the blood vessels within the body. Autism and Alzheimer's, there's research, a lot of research, especially with Alzheimer's right now. It's becoming a far more common problem in the United States. It's expected to potentially, in the next 50 years, maybe even bankrupt our entire healthcare system because of the number of people that are expected to be in this category that are going to need to be cared for. And it's just a scary, scary thought about that. D3 is definitely something that can help prevent and is actually being tested and on super high level doses to be seen if it can actually reverse Alzheimer's, and there's some positive research pointing in that direction, but there's a lot more tests that still need to be done with it. There's a lot of papers that have been done with autism and the spectrum kids that are having these issues, but some of them are having great responses once they start getting their D3 levels into the proper level. And it's far more complicated than me just saying that. And I could spend hours and hours and hours on this vitamin alone. So I'm condensing a lot of this information. If you have a question that you want to personally come to me and ask me about, please do it. And I will pull these papers out for you, and I'll give you the exact references if you need them and go into more detail. Infections, bacterial and viral, all help with the vitamin D3 if it's in the normal range. And we're going to talk about what the normal range really is here in a little bit. But all infections, bacterial and viral, can be responded and help prevented. If you get low, you're super vulnerable to infections. And again, that's why we talk about the changes in this time of year, the winter months, and how it can be affected. The bone strength, we mentioned that before. And osteoporosis, that's something we've known the effects of D3 for many, many years now. It seems as though with the D3 that the vitamin K2 that was just a recent discovery is also really necessary in order to transport the D3 and get it into the bone. So if osteoporosis is the reason you're taking D3, you need to make sure either D3 has K2 in it or you're also taking a K2 supplement to go with the D3. So it helps with the absorption into the bone, and it'll take more calcium that way, and the bones get much stronger. Multiple sclerosis. It's an interesting paper, and I bring this up because MS is a disease, we don't know where it comes from. It follows a viral pattern. Maybe it's a virus, we don't know. But what we do know is this odd thing about it, that the level of, there's almost no reported cases of multiple sclerosis near the equator. And as you move further and further and further away from the equator, where we get most of the sun, we see higher and higher and higher incidences of multiple sclerosis, where people are getting less sun exposure. So there is some type of link. Again, a lot more tests need to be done about it, but there's no doubt that this is a vitamin that our body needs. And if you're dealing with any of these conditions, you should seriously get your levels checked to make sure you're within a normal range. All cancers, there's a lot of papers that are out about cancer and D3 and what's happening with when you're out of your normal range. About 50% in colon cancer we believe could be prevented, as high as 90% of breast cancer, and on average most of the cancers are showing about a 75% decrease in people with normal levels versus people with really low levels of vitamin D3. So again, more studies need to be done to really specify this, but to even see those types of numbers, to think that potentially we could stop 90% of breast cancer if we just had the vitamin we're supposed to have in our system in a normal range, it's kind of crazy to think about how many people could potentially be suffering. And this stuff needs to be looked at, because there's no better way to fight cancer than to absolutely and positively prevent it in the first place and never get cancer that has to be fought and defeated. So we're looking for ways to try and be healthier so we don't get these conditions, not necessarily treat these conditions. But if you have fallen into some of these categories, this is something you really need to be looked at. It can't be overlooked. So how much do we need? Well, when it comes to how much sun exposure, it depends on the time of the year, how much sun we're getting, the intensity of the sun. On average, we need probably about 20 minutes of sun exposure on a person who's in like a bathing suit to get that much skin exposure for about 15 to 20 minutes for the average adult. Now, obviously, some of us, different times of years, we're going to have clothes on. There's going to be different parts covered, so you may need a little bit more exposure to produce it. You get in that 30-minute range, you're good. Skin color does have an effect. Some of us have darker skin tones. That means we're going to be reflecting certain amounts of light, absorbing things differently based on our skin color. And some people have a tendency to not produce as much vitamin D because their skin is more protected from the sunlight. So that is one of the things that can be, has to be looked at. So 30 is the new 70. And I say that because this condition has become so rampant, and because there's 85% of our culture that has become so low on the vitamin D3, that now, instead of saying between 50 and 70 is normal, and 70 is a great number to be at, now we've changed the number. So instead of saying there's a catastrophic event occurring, we just said, let's just lower normal. So the powers that be took 50 and they said, no, you know what, we're just going to call 30 low normal. So that doesn't mean it's normal. And actually the research studies that I showed you before are studies that show to the level that you get below 45 and below 40, you're in a lot of trouble as far as how much you're at risk for cancer and infections and everything else. So 30 is not a good number. I don't trust it at all. You have to be between 50 and 70. 70 is good. And if you're trying to deal with any type of health issue, 70 to 100 is the range you need to be in order to help fight different conditions. So this is what we're learning. Average adults need about 5,000 IUs per day. Now there are some great supplements out there. We have a great supplement here that I've researched for many years. I have seen the pre and post blood tests with our patients. It works. And it definitely beats any of the prescription level D2, which is really not D3, that most people are prescribed. So infants, we talk about 800 IUs up to and about puberty, about 2,000 IUs. And the best way to calculate this is you need about 35 IUs per pound of the person that's taking it. So you can kind of get into that range. If your child is a little bigger, but they're not a puberty range, they may need a little more, obviously. They weigh more, their body's a little larger, their body's a little smaller, they don't need as much. But the 35 IUs per pound is a relatively new way to factor out the right level that you need. I tend to recommend in the summer months to lower it a little bit for adults to 25 because we are getting more sun exposure during that period of time, but definitely at least 5 during the winter months and higher if you're fighting some type of infection. Everybody's different, so please ask me and talk to me about it when you come see me at the office, or send me messages so I know what your questions are. D3 is good, D2 not as good. I talked to you about that before. Does not change the level of D3 in your body anywhere near as effectively as a really good D3 supplement will. And if you know you're trying to do something because you want to buy something that's cheaper, it's almost always not better. So that may mean that you may be taking it and wasting your money altogether. So I would make sure that you're pre and post blood testing to make sure that what you're taking is actually really working. I believe the way the culture is going, and because this issue has become such a big issue, that we're going to actually see like over-the-counter testing kits that you're going to be able to buy here shortly, that you're going to be able to prick your own finger and do the test. I know that's probably not far away, but it's something that we need in our culture desperately to be able to make sure that we're within a healthy range. So, cold and flu season is a-coming and is upon us, so I wanted to throw in a couple little extra tidbits about this. And number one, the best prevention I know of is to have the knowledge to do the right thing. And for us, most of us, chiropractic is one thing that I can see, have seen for over 30 years, has helped people with their immune system and immune responses. The nervous system controls everything in your body, and it's actually the nerve endings that in different parts of your spleen and lymphatic system that trigger and activate these white blood cells to attack. There's studies that tell us that within an adjustment, within about 36 to 48 hours after an adjustment, your immune response is much higher than the normal person's is. So it's important to get adjusted. There's definitely a correlation there. Exercise is critical. Some of us, if our exercise is really intense, heavy lifting, hard running, your immune system actually takes a dip for about 30 to 45 minutes after you work out before it responds because it's busy taking care of the damage that you did to the tissues. So exercise is important. It may not need to be as intense this time of year. So it's still important to get it done, but you just got to maybe go a little bit easier through the winter months, and that way you don't put that stress on your immune system and make yourself vulnerable. A proper rest, we have to sleep. That's when your body repairs, that's when your body recharges. And if anybody's ever had a cold or been sick, you're tired. And that's because your body wants you to rest so it can go battle and take care of whatever's in your system that's not supposed to be there and get it out of there. Decrease your stress, I mentioned before, and of course smarter nutrition. Sugar is a huge inflammatory. Bacteria love sugar. Cancer cells love sugar. Stay away from it. I talk about it in almost every one of my classes. A lot of information coming out about that. D3, people, I'm telling you right now, there is no other vitamin. If you can only take one vitamin, there's nothing else you can take. You got to get your D3 tested and make sure that you're in the healthiest range and make sure you're taking some sort of supplement to help you maintain those healthy levels. And whether it's wintertime or summertime, if you're in a building, you're not getting enough. I can almost guarantee it. So get those levels tested. Come to me with any of your questions. I can get you research on top of research on top of research if you want proof for anything that I'm saying here in this class. And feel free to reach out to me anytime. Thanks for paying attention, thanks for staying tuned, and thanks for coming.
Thank you for watching our video. If you like what you saw, be sure to subscribe to our channel.
Yeah, and like us on Facebook. There's always a lot of information also on our website at rosemontchiropractic.com.